Vending of food and drinks in school premises has been banned. In a raft of measures announced by the government to prevent and mitigate alcohol and substance use in schools, random searches by law enforcement officers will be conducted in schools to reduce supply and trafficking of the substances within schools. This as it emerges that primary school children as young as the age of 4 and on average at the age of 11 are abusing at least one drug or substance. Dr. Swangira reports.
That drug and substance abuse is a problem in Kenyan basic institutions of learning is not entirely new. However, the findings of a survey report conducted by NACADA in 2019 points to an alarming trend given the young age of the learners affected. According to the findings of a national survey on the status of alcohol and drug abuse among primary school pupils in Kenya, conducted by NACADA in 2018, the average age of onset of at least one drug or substance of abuse was 11 years. The lowest age of onset of at least one drug of abuse was 4 years. Further, at least 2 in every 10 of primary school pupils had used at least one drug or substance of abuse in their lifetime, a situation that will continue to escalate unless comprehensive strategies to prevent and mitigate it are put in place.
The onus of the parents of the children to make sure that they practice what they preach. The child sees you with a guest who comes and you stay for 8 hours drinking alcohol. That is what has registered on the child.
But with a majority of schools not having a comprehensive policy on alcohol and substance use, the Ministry of Education, TSC, and NACADA have developed these national guidelines to provide direction and coordination for prevention and management of alcohol and substance use in basic education institutions. They provide a blueprint for heads of basic institutions, teachers, and caregivers in responding effectively to alcohol and substance use issues. The guidelines focus on supply reduction, preventive education, incident management, counseling, referral and support. To reduce supply of the banned substances in schools, vending of food and other substances in schools has been abolished. Bars and drug-using establishments should not operate within 300 meters of a school compound. No erecting of advertisement of billboards and regular comprehensive whole school inspection, including impromptu searches involving law enforcement authorities.
On this, my ministry is regularly conducting compliance checks to ensure that there are no alcohol selling premises near institutions of learning for persons below age of 18.
In 2016, a NACADA survey in secondary schools showed that the most abused drugs and substances were alcohol at 3.8%, prescription drugs, miraa and cocaine. The leading sources for this were kiosks and shops near schools, bars near schools, friends and other students.
The primary school survey findings pointed to the role of adults in children initiation to drug abuse, as 29% of the pupils reported that they get drugs from shops or kiosks near their schools.
In the multi-sectoral approach for implementation, the Ministry of Education is tasked to mainstream alcohol and substance abuse in curricular and co-curricular activities and disseminate guidelines to stakeholders. TSC is tasked to take action against teachers implicated in trafficking and sale of alcohol and drugs to school-going children and to support teachers with substance use disorders to receive counseling, rehabilitation and aftercare services. While the Ministry of Interior is tasked with collaborating with county governments towards closure of kiosks and vendors operating next to schools and supporting schools in handling incidents that relate to illegal drug possession through national government officers and local security agencies and creating a safe environment in the community by ensuring arrest of those selling alcohol and other drugs to children. Dorcas Wangira, Citizen TV, Nairobi.